Yeah, just a quick review of the Bauerfeind GenuPoint knee strap. So basically, these bands decrease pain in your knee by decreasing strain on your patellar tendon. So here's your patella, and the patellar tendon is underneath it, it goes here. So researchers think that there's two main ways that these bands work to do this. The first thing is they find that it increases the angle between your patella and the patellar tendon. So your patella tendon sits at a certain angle, and then your patella sits at another angle. And when you put this band on, it increases the angle, and they think that decreases stress on the patellar tendon. The other thing they find is that it does decrease patellar tendon length. Okay, so they think that contributes to less pain. Yeah, a few points about this particular little knee strap. I like this one because it's the first one I've seen that's anatomically contoured, meaning that, if you go down here, there's a little dip in here. So that way it doesn't push too much in on your kneecap. So I really like that. The other thing I like about this is it has two straps. It's not just one Velcro that goes right across here. There's actually two straps that you can pull back and then attach it. So I think you get a little finer adjustment with that one. So I really like that. Anyway, other things you can do if you have a knee pain, so put a knee strap. I'm getting this from this book, Bulletproof Your Knee. This is one resource. If you have any kind of knee problem, make sure that you're definitely strengthening your quadriceps muscle. The quadriceps muscle is a big muscle here on the front of your thigh, and here's your kneecap for reference, for your patella. So right above it is your quadriceps muscle. Quadriceps muscle are key in stability and stabilizing your knee joint. What they're finding is that when people have a lot of different knee problems, they selectively have decreased strength in their quadriceps muscle. For some reason, it's just the quads, not really the hamstrings or the adductors or any of the other muscles right at the knee there, mainly the quads. As an example, knee swelling in the quadriceps. Study demonstrated that even if you have little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of acute or chronic swelling, it kind of has an effect on your quadriceps muscle and makes it weaker over time. Knee injuries in the quadricep, if you ever had broke like your tibia, your lower leg bone, if they have had surgery where they've opened up your knee joint, puts you at risk to have decreased quad strength. Ligament problems in the quadriceps, anterior cruciate ligament, that's your ACL. You've heard of football players tearing that. Look at people who ruptured their ACL. Found that the strength of their quadriceps muscle in the injury leg was decreased by 25 to 30%. So that's a huge hit out of this, takes a big chunk of strength out of your quadriceps muscle. Kind of hard to get better and get pain-free if you don't have, if you have that much decrease in quad strength. Same thing with the posterior cruciate ligament, the medial collateral ligaments, all the ligaments around your knee. If you've torn them, have a problem with them, can affect your quad strength. Knee pain in the quadriceps, research were able to show that the knee pain actually caused a 14% decrease in quadriceps strength. So that's an experimental do. So if you have like chronic knee pain, you're at risk to have decreased quad strength. Here's a good one, knee arthritis in the quadriceps. So there's tons of research, really is tons of research, showing that if you have knee arthritis, you probably have weakness in your quadriceps muscle. And actually, randomized controlled trials show if you take a group of people with knee arthritis and you do a randomized controlled trial on them, like half of them do, like say nothing, the other half strengthen their quads. If people just strengthening their quads, the knee pain starts to go away. So that's a good way to treat your knee arthritis. The other thing they find is that people with the stronger quads with knee arthritis have less progression of their knee arthritis. So this actually kind of interrupts the whole pathological process, strengthening your quads. It's really interesting. Just another reason, if you have knee arthritis, definitely do at least one exercise. Patellofemoral pain syndrome, and the list just goes on and on with all these knee problems that are associated with decreased quad strength. So fine-tune control over your knee. Here they're talking about the hip muscles. Sometimes you can have knee pain. There's really nothing going on in your knee. It's actually a problem up at your hip. Classic examples like iliotibial band syndrome. You take a group of people with iliotibial band syndrome and you test their hip muscles, you find their hip abductors, which is a key muscle to keep your pelvis level when you're walking and it brings your leg out to the side. Find they have hip abductor. Gluteus medius in particular is a big, gluteus medius is a hip abductor. A lot of gluteus medius weakness in these patients. Likewise, here again, randomized controlled trials strengthen the gluteus medius muscle, the hip abductors, and iliotibial band syndrome goes away. So how about that? Keeping your knee flexible. We all know it needs to bend and straighten fully. What a lot of people don't know is that your knee actually rotates. About the last 10 to 15 degrees of you straightening your leg out, your knee actually rotates out to the side. And here's a little test to see if you have that accessory motion. So you need that motion really for full knee functioning. And probably the last thing I can think of that you could do, increase knee stability, dynamic knee stability. So here they're talking about proprioception. So for instance, if I turn the lights out now, you'd probably be able to tell me whether your knee is bent or straight, okay? That's because you have little nerve receptors in the joint and the soft tissues and the muscles around your knee, and they give your brain constant feedback as to where your knee is. What they're finding, if you look at people with certain knee problems, that they actually have decreased proprioception. So it's not like you don't know where your knee is anymore, but it's not as good as it should be. And that has to do with kind of protective, like say you step off a curb, all of a sudden you need to know where your knee is right away instantly, so that you can brace it when your foot lands unexpectedly. So a lot of prevention with that. Lots of things you can do. But hey, nothing's as quick as put on a little knee strap. A lot of people report that they have decreased pain right away. So get a little knee strap. Check it out.